We're counting down the top 10 health benefits you'll unlock by eating just one tomato every day. From rapid changes you can feel after a single serving to long-term defenses against serious disease, these benefits range from the obvious to the life-changing, and a few might truly surprise you. Which daily effect tops the list? Let's start our countdown with number 10. In the 10th place, tomatoes deliver an immediate boost to digestive health thanks to their combination of fiber and water. Each medium tomato contains about 1.5 to 2 grams of fiber, along with a remarkable 95% water content. This synergy softens stool and speeds up transit through the digestive tract, making it easier to stay regular and less prone to bloating. For many people, just a few days of adding one tomato to the daily routine can ease constipation and support a healthier gut. For a quick tip, try adding chopped tomato to your morning yogurt or toast, and you may notice results within days. Number 9. Tomatoes quietly contribute to bone strength over the long term. Each medium tomato provides about 8 micrograms of vitamin K, about 7% of the daily value, alongside a small amount of calcium. Vitamin K is essential in activating osteocalcin, a protein that binds calcium to the bone matrix, helping maintain bone density as we age. While the vitamin K in one tomato is modest, regular intake supports a broader diet that protects against fractures. For those on blood thinners like warfarin, it is important to talk with a doctor before increasing vitamin K foods. The evidence is moderate, but every small step counts for lifelong bone health. In 8th place, tomatoes play a practical role in weight management because they are low in calorie density and high in fiber. A medium tomato contains about 18 calories, yet its water and fiber help you feel full and satisfied, making it easier to control portions and reduce unnecessary snacking. This effect is immediate. Adding tomato to meals increases satiety without adding extra calories that can turn into fat. In a large study of over 27,000 women, those who ate at least 10 servings of tomato per week had better glycemic control as measured by lower HbA1c, a key diabetes marker. For anyone looking to cut calories without sacrificing nutrients, tomatoes are a smart addition to salads, soups, or as a snack on their own. Number 7. Tomatoes offer emerging support for brain health through their antioxidant arsenal, particularly beta-carotene. While most headlines focus on lycopene, beta-carotene is a lesser-known carotenoid that can cross the blood-brain barrier, where it helps neutralize oxidative stress, a process linked to memory loss and cognitive decline. Laboratory studies confirm that beta-carotene from tomatoes is detectable in brain tissue, and its antioxidant action is thought to shield neurons from damage over time. Early human trials are promising. In a small 12-week study, participants who drank tomato juice daily saw measurable improvements in working memory scores. The evidence is still developing, but these findings suggest that adding just one tomato to your daily meals could play a subtle role in supporting mental clarity and protecting your brain as you age. Number 6. Tomatoes bring visible changes to your skin from the inside out. One medium tomato delivers about 14 milligrams of vitamin C, covering nearly 1/3 of your daily needs. Vitamin C is the key ingredient for collagen production, the protein that keeps skin firm, elastic, and youthful. Over time, this means fewer fine lines and better skin texture. Tomatoes also help defend against sun damage. In a clinical trial, people who ate tomato paste with olive oil every day for 10 weeks experienced 40% fewer sunburns compared to those who did not. This protective effect comes from tomato antioxidants, which help shield skin cells from ultraviolet rays and urban pollution. The result is a natural glow, less redness, and fewer blemishes, evidence that what you eat truly shows on your skin. Number 5. Tomatoes quietly reinforce the body's immune defenses through a combination of provitamin A carotenoids and folate. Provitamin A from tomatoes helps maintain the integrity of mucous membranes, your body's first line of defense against invading bacteria and viruses. Folate, though present in moderate amounts, supports the formation and function of white blood cells, which are essential for fighting off infections. While a single tomato won't prevent illness on its own, it contributes to a diet that helps the immune system respond more effectively. Studies suggest these nutrients work best as part of a whole food approach rather than isolated supplements. For most healthy adults, including tomatoes regularly, can mean fewer sick days and a more resilient immune response, but anyone with immune conditions should consult a clinician before making big dietary changes. Number 4. Tomatoes offer subtle but meaningful support for eye health through their content of lutein and zeaxanthin, two pigments that naturally accumulate in the retina and lens. These carotenoids act like internal sunglasses, filtering out harmful blue light before it can damage sensitive eye tissue. A medium tomato contains about 78 micrograms of lutein and zeaxanthin combined. That amount is only a fraction of what clinical trials such as AREDS2 used, where daily supplements of 6 to 10 milligrams cut the risk of age-related macular degeneration by up to 25%. Even at lower levels, regular dietary intake contributes to the pool of macular pigments, supporting the eye's natural defenses against oxidative stress and gradual vision loss. To maximize protection, tomatoes work best as part of a varied diet that includes leafy greens and other pigment-rich foods. Coming to the top 3, tomatoes play a significant role in regulating blood pressure. They are rich in potassium, about 292 milligrams in a single medium fruit. Potassium works by counterbalancing sodium in the body, helping blood vessels relax and supporting steady circulation. Large-scale cohort studies, including the pre-dimed trial, found that eating more than 110 grams of tomato daily was linked to a 36% lower risk of developing high blood pressure in people without previous hypertension. Controlled trials back this up. In one study, a standardized tomato extract taken for 4 weeks led to measurable drops in blood pressure among adults at high cardiovascular risk. These benefits are considered moderate to strong, with both observational and intervention data supporting daily tomato intake as a practical step for heart health. However, for people with chronic kidney disease or anyone taking potassium-altering medications, extra potassium can be risky. Medical guidance is essential before making dietary changes. In second place, tomatoes stand out for their robust support of heart health. Regular consumption of tomato products, especially when cooked with a small amount of olive oil, has been shown to lower LDL cholesterol and improve key vascular markers. In a controlled trial, participants who ate 150 milliliters of tomato sauce daily for 8 weeks saw their LDL cholesterol drop by 12%, a result on par with some cholesterol-lowering foods. These heart benefits are linked to powerful compounds like naringenin and lycopene, which work together to inhibit LDL oxidation and boost the body's antioxidant defenses. Beyond the lab, large Mediterranean population studies reveal that people whose diets are rich in tomatoes experience up to 30% fewer coronary events over time. The evidence is labeled moderate to strong, with multiple studies confirming that tomatoes support healthy arteries and reduce inflammation. For the greatest benefit, simmer tomatoes in olive oil. This simple preparation unlocks the full potential of their heart-protective nutrients. And finally, in first place, tomatoes may play a role in reducing cancer risk, especially for prostate cancer, thanks to their rich supply of lycopene. This red pigment is more than just a color. It acts as a potent antioxidant, and its effects have been studied in thousands of men over decades. Large prospective studies like the Health Professionals Follow-up Study found that men who regularly consumed at least 100 grams of cooked tomato products per week, about 1 tomato's worth, had a 10 to 20% lower risk of developing prostate cancer compared to those who ate less. Meta-analyses pooling dozens of studies echo this trend, with the strongest association seen for cooked or processed tomatoes, not raw. That is because lycopene becomes much more absorbable when tomatoes are simmered in oil, a classic Mediterranean preparation. Still, it is important to keep perspective. These findings are population-level associations, not proof of direct prevention. No randomized trials have confirmed that eating tomatoes will stop cancer from forming, and the benefits appear modest, mainly for early-stage disease. But as part of a long-term tomato-rich dietary pattern, especially when paired with healthy fats, the evidence supports a meaningful, if moderate, reduction in risk. For those seeking maximum benefit, aim for cooked tomato dishes several times a week. The science is promising, but tomatoes are best seen as a smart habit, not a cure. Across all 10 benefits, one pattern stands out. Small, daily choices shape our long-term health. A single tomato packed with nutrients quietly supports nearly every system in the body. It's proof that simple habits, not radical changes, can have the biggest impact. Sometimes wellness is just one bite away.